Good evening, good afternoon, good morning, ladies and gentlemen. I'm Dr. Lungu Patrick, the National TB and Leprosy Program Manager for Zambia. I'm happy to share with you at this conference a topic, navigating the impact of COVID-19 on TB programming and how a change in approach to information turned the pandemic into a success. So just to qualify, ladies and gentlemen, that I have no conflict of interest to declare. And the background to this topic, as you may be aware, that health sectors across the globe were heavily affected, if not negatively affected, by the COVID-19. And this was as a result of repositioning the human resource for various public health intervention to respond to the global pandemic. Zambia too was not spared by the COVID-19. And just to share with you that the TB program was heavily challenged by the COVID pandemic. And one of the things that we did as a country is that we set up a TB situation room. A short background to the TB situation room is that prior to the COVID-19, if not in 2019, Zambia had started a weekly surveillance. And this proved to be an opportunity to enhance our visibility to the TB response amidst a challenging time brought about the COVID-19. And what we did see, going by the resounding from the Stop TB Partnership, where they had actually notified TB programs across the globe that the COVID-19 pandemic was going to negatively affect the TB response. We started paying attention to the weekly TB reporting. And what we did see, colleagues, is a decline in the weekly TB notification, to which it amounted up to 18% decline from the previous weeks prior to Zambia notifying the first cases of COVID-19. So essentially, the weekly reporting proved to be useful to us as a country, and it did inform us on what was actually happening to the TB program. So essentially, the TB situation, colleagues, is nothing other than a virtual platform, essentially a Zoom platform, and it can also work on other virtual platforms such as Teams. So within the weekly report, within the TB situation, on a weekly basis, stakeholders from various circles, starting with the national level, the various partners, the sub-national level, and also other players such as the leadership, do participate on these weekly meetings. And we do convene these weekly meetings using various, using what we call a dashboard. And this dashboard does track key TB indicators, starting from presumptive TB patients, drug-susceptible TB notifications, drug-resistant TB notification. And also we do track quality indicators such as the bacteriologically confirmed proportions and versus the clinically diagnosed. And equally, we do track mortality on a weekly basis. So how does this work out? This works out by facilities putting up their weekly report and sending it to the districts that puts it up together as a district report. And within a particular province, they put up a provincial report, which after review and validating, they send it up to the national level. And we do put up together what is called a national weekly TB situation report. And just to qualify that, besides the national TB situation room, we have situation rooms at sub-national level. So as I earlier said, the data starts from facility all the way up to the national level. And as you can see from the slide here, that we have players meeting virtually in the TB situation room, discussing the data. And we use this data to identify shortfalls in our TB response, shortfalls in the supply chain for TB commodities. So the TB situation room, colleagues, proved much useful to bring about accountability to the delivery of services. We're able to realize areas where there was suboptimal TB interventions, and we were able to provide the much needed technical support at such a challenging time. And equally, we're able to notify, to be alerted to some of the gaps in the supply chain, and we did utilize the various mechanisms of this platform to rectify those shortfalls in the supply chain. So as I earlier said, in the wake of COVID-19, starting from week 12, where we did realize, where we did pick up the first cases of COVID-19, we started to see a decline. And in week 19, we set up the TB situation room, and this situation room was launched by our permanent secretary in charge of health. And what we started to see was a positive response. The grassroots did respond to the cause, to the guidance that TB interventions needed to be sustained. So as I said, the TB situation room has had a positive impact, not only during the peak years of the COVID-19, but even now, as you can see, the trends of the bacteriologically confirmed by the various years, 2020 in blue, and 2021 in red, and 2022 in the gray bars. So you can see from this is that we did improve our bacteriological pickup in 2021 when we compare to the 2020. And I wish to also inform you that 2021 was the worst year in terms of COVID. This is when now we had waves after waves, and the COVID was at its peak, yet we increased our bacteriological confirmation. And if you can see in 2022, the performance is far much better than the 2 years, 2020 and 2021. So we essentially use the data to institutionalize the best practices and to strengthen the TB response. As you can see here, that when we now compare the sum totals of bacteriologically confirmed cases of TB in the first 43 weeks of the 3 years, 2021 was better than 2020, and 2022 is far much better than 2022. Just to inform you that the sum total that are bacteriologically confirmed as of week 23 surpasses that of the sum total of the preceding years. So indicatively, this year we'll have a much higher performance because this is only the first 43 weeks. So in terms of the total notifications, as you can see, we had started increasing our total notifications preceding the years of the COVID-19. 2019 was better than 2018. And this is where we started strengthening the TB program. But now when we utilize data, we had even a much higher response. We were much more informed. As you can see in 2020, there was an exponential growth in TB notifications. As of week 43, we are already at 46,000, surpassing the performance of the entire 2020 and the preceding years. Indicatively, again, 2022 will be a better performance than 2021. So meaning, and this is all as a result of the critical use of data for decision-making and action. So colleagues, we are now stepping forward our utilization of data, and we support from KNCV. We're now transitioning the TB situation to a live data based platform in the form of DHIS2. So facilities will be entering the data directly into the DHIS2 and will be creating weekly dashboard. And this will also create a base and database for historical data. So how do we wish to step forward again is by expanding access to the TB situation room by creating logging in credentials for key stakeholders. And equally, we'll move on to build capacity in the data entry and use for the TB DHIS2 platform. And later on, we will monitor the implementation of the TB situation room in the DHIS2 and review the process after 6 months. So the underlying point to take that data use and regular reviews of data brings about accountability, and it is a critical ingredient in spurring the TB response. As a country, and together with KNCV, we stand ready to support other countries or other programs that would like to take up a similar initiative. With that, ladies and gentlemen, I thank you for attentive listening and happy to take up questions and clarifications on my presentation.